As providers embark on their population health management strategies and start actually changing how they deliver care, they need very different capabilities than they've had historically. We in the report frame out 4 key components of what we feel are the necessary capabilities. First, data integration. Second, clinical analytics. Third, care management. And fourth and last, patient engagement capabilities.
You can think about data integration as really the data repository that fuels the broader framework of population health management. So historically, we've been dealing with a lot of claims and clinical data. What we're starting to see more now is incorporating other sorts of data, so lab data, pharmacy data, socioeconomic, biometric, other sources of external data, and they're creating much more rich insights.
Once provider organizations have the data ingested, now what do they do with it? And they need comprehensive and sophisticated analytics capabilities to make sense of that data and to glean insights from it.
We have so much information that is flowing through the system every single day. How in the world do we make sense of it so that we can ultimately stratify our populations and figure out whom are the members or the patients that we need to apply our scarce resources against to improve the overall health of a population, however you want to define that.
Given the vast amounts of data that are now coming into healthcare, artificial intelligence has a really interesting opportunity to make it very actionable and personalize that data so we can truly understand the progression of disease and the key points of intervention that are really going to improve outcomes.
We have a lot of brand new ways of cutting and looking at data, and care management is really where the rubber meets the road for some of that. So some of the new technology-based approaches to data, clinical data, claims data, et cetera, have created opportunities to change behavior, which is really one of the key pieces of moving the healthcare system towards a value-based care approach.
Care management is all about optimizing each patient's journey across the healthcare system. As we know, it can be complicated. And effective care management capabilities get the patient to the right care that they need at the right time, and hopefully in a way that's preventative as opposed to reactionary to severe health needs.
Patient engagement is incredibly important to population health management because at its core, population health management is really delivering the right intervention at the right time, in the right place, to the right individual. And to be able to execute that strategy in practice, you need to have an activated patient base. And in order to activate a patient base, you really need to engage them.
Patient engagement is the last mile in population health, in actually interacting and communicating effectively both ways between the provider and the patient back to the provider to make sure there's clarity on what the patient needs to do to be successful in their healthcare. As providers embark on their population health management strategies, all of those together are required to be successful as people and providers move into value-based care.